inmates, the county had to vaccinate most of the others. One physician claims the jail is ripe for an explosion of tuberculosis at any time. In the midst of all this, the Texas legislature has given sheriffs the authority to order inmates to pay for their own medical care. The sheriff in Houston did. Inmates don't earn any money while they're in jail, so they'll be forced to use the money they get from relatives for toiletries and snacks.
The average inmate spends in excess of $40 a week through the commissary. And if they're spending that kind of money for munchies, they can certainly be paying some for medical services.
The sheriff says this will save the taxpayers millions, and he insists inmates who do not have any money will still get free medical treatments. But most of them do have some money. Inmate Victor Herrera says he and the others will refuse medical care rather than use their own money.
They have it overcrowded all the time, and it's pretty easy to pass germs from one person to another. If anybody's infected with anything, it'll be a problem that'll get out of hand.
A problem that could spread to the streets. Hundreds of inmates here are periodically given an early release because of overcrowding. Gerald Bernberg is a lawyer for the inmates.
What's going to happen is those inmates are going to be coming back into our community, back onto our streets, and they're going to be contaminating us. That's the big problem. The new policy may be good politics, but it's terrible public health.
Many politicians do support the sheriff's decision to make the inmates help pay for their own medical care. After all, it is an election year. Jim Cummins, NBC News, Houston.
They plan to be an HIV center here, a model for the state and, for that matter, maybe the country.
But last weekend, another inmate in one of the AIDS wards died. His friends say prison officials ignored his calls of man down, the prison code for help.
He banged on his door and banged on his door, and he banged so hard that the people in the adjacent wing, which is 50 yards of open space, heard him. Yet his cries for help went unnoticed, or no, they went unheeded. Excuse me, they went unheeded. The man was found dead, sitting on his toilet. He had been sitting there for a long period of time. We were wondering why this man wasn't discovered in the middle of the night when the checks are to be made, the institutional checks on the inmates.
The incident seems to have destroyed the fragile bridge of trust and cooperation prison officials and inmates were building.
It is disappointing because weekly we did get the impression that they could see that there were changes, and it appeared like they were satisfied with the direction in which we were heading, and they knew of like my recruiting efforts.
Andresen says he has been working very hard trying to fill those 3 new slots for the HIV specialists. The prison now has 2 HIV doctors, 3 days a week. Dr. Andresen says he hopes to have at least one of those new doctors on board before the end of this year. But if it hadn't been for the 2-month-long budget stalemate in Sacramento, they might all have been here by now. Yesterday, 2 inmates went on a hunger strike, vowing not to eat till prison officials meet 5 demands. One is a meeting with State Corrections Director James Gomez. Inmates also want an independent investigation of the deaths.
Even if you can't get adequate medical care, there's still no reason to keep people locked in their cells to die.
If Brian Carmichael is HIV positive, he doesn't know it. He refuses to let prison doctors test him.
My friends that test HIV positive are sent to another side of the prison where they're supposed to have better access to medical care. They have less and less adequate medical care.
Inmates say the last thing they want to do is to draw attention to themselves by complaining. But those we talked to today say they feel the situation in the AIDS wards here will not improve unless they stay involved. In Vacaville, Betty Ann Bruno for the 10 o'clock news.
The president went to prison today, along with the vice president and 7 cabinet secretaries, to announce a major shift in the nation's strategy for combating drugs. Mr. Clinton wants Congress to put more money into prevention and treatment, less into stopping drugs at the borders. He told the inmates he spoke from personal experience.
I have had the questionable privilege of living in a family that has dealt with both alcoholism and drug abuse.
Did an Alameda County jail inmate suffer a seizure and die while sheriff's deputies ignored cries for help? The woman inmate died yesterday afternoon while awaiting arraignment at Municipal Court in Oakland. In an exclusive interview with the 10 o'clock news, a witness says deputies did not respond until it was too late. Diane Dwyer is in Oakland with a live report. Diane.
Dennis, sheriff's deputies say 26-year-old Tracy Shama was awaiting arraignment on prostitution charges yesterday when she became ill and died. At the time, she was being held in a group holding cell at the Oakland courthouse. Witnesses say they tried for nearly a half hour to get help.
I heard, "Help, deputy, help. We need help. We need help. The lady is passed out. She in here having a seizure. We need a deputy. We need medical attention. Help, 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 help." They kept screaming, and, you know, you can hear in their voice that it was real.
Johnny Shivers says he was in the adjacent men's holding cell awaiting arraignment on a traffic violation and could only hear, not see, what was happening in the women's holding cell next door.
The guys in the cell started kicking and banging on the doors, you know, just trying to get the deputies to come see what was wrong. They just kicking and banging and screaming and, I mean, just mad.
This holding cell is similar to the one they were in. Shivers says the commotion lasted between 15 and 30 minutes. There are surveillance cameras that the sheriff's deputies use to monitor inmates. Finally, he says one of the inmates put his hand over the lens of the surveillance camera, and it was only then that deputies responded.
That had to be maybe 20 minutes to 25 minutes into the ordeal. I'm talking about from the time I heard the lady crying and screaming before the deputies were notified.
Deputies say the 26-year-old victim, Tracy Shama, was not breathing and had no pulse when they arrived. Paramedics rushed her to Summit Medical Center, where she was pronounced dead on arrival. The county coroner is running tests to determine the cause of death. The Alameda County Sheriff tells the 10 o'clock news that preliminary reports show response time was, quote, okay.
We are also doing an internal investigation to find out how long it was from the time that she became ill until we were notified and we were able to respond.
Plumbers deputies say Shama was a familiar face at the Oakland Municipal Court and jail.
Arrested the day before by the Oakland Police Department for prostitution. She is a narcotic addict with needle marks in the arms and in her neck.
Others, though, say no matter what Tracy Shama's background, she deserved better treatment.
The lady probably would have had a fighting chance. You know, that's what upset me is she might, you know, she might not have, but just that amount of time to get medical attention in a facility, you know, that you, I mean, it was ridiculous. It upset me very much.
Tracy Shama lived in Alameda with her 2-year-old son and her mother. The coroner's office says it should be able to determine a cause of death by next week. Dennis and Elaine?
Diane Dwyer, thank you.